Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We're going to be speaking with Rob Graybill in this segment. He's joining us here to talk about some new research that shows that households have delayed or avoided medical care or the purchasing of prescriptions due to rising cost. He's going to talk about transparency in coverage. Welcome to Health Professional Radio, Rob Graybill. Thank you for joining us this morning.
Thanks, Neil. Appreciate the time. Let me tell you a little bit about myself. So I lead strategy within Zelis, and I'm focused on our digital transparency platforms and programs for consumers. A bit about my background. I spent over a decade in healthcare and technology before co-founding our SmartShopper business, where I serve as general manager. You'll hear more about that through the course of the conversation. I'm passionate and focused on helping consumers find and get the care they need. I like to say I've got the best job in the world. I get to send my customers reward checks in the mail simply for saving money on the healthcare. Looking forward to the conversation today.
Now, I did say that you were going to talk about some new research that reveals over a third of households in most income brackets. So that means it doesn't matter whether you're sitting pretty or you're struggling. You're either delaying or avoiding medical care or purchasing your prescriptions because of the rising cost. It's healthcare. No matter how high it gets, we're kind of obligated to take advantage of it.
Sure. It's not surprising, and unfortunately, the trend isn't new. The cost of healthcare has been a source of frustration and delayed care for years. Surprises can be fun, Neil, but not when it comes to your healthcare. I think we've all had that moment over the years where we get a bill after the fact, and you say, that procedure cost me what? Inflation has brought that type of fear of unanticipated bills and surprises back to the forefront, back to the kitchen table, where Americans, as you mentioned, all income levels, are having conversations and making tough choices about their finance. So again, this is contributing to a concerning trend. Delaying important health care include preventative screenings such as colon cancer screenings, which we want Americans to have. But it doesn't have to be that way. Uncertainty about healthcare costs doesn't and shouldn't be a barrier to getting you the care that you need.
I've never known what a procedure was going to cost until I got the bill. And I've had identical procedures at different times, and they were vastly different as far as the cost was concerned. It seems that what costs what is a big mystery when it comes to healthcare, and we just say, hey, I'm sick, I'm hurt, I'm broken, I need to go to the doctor, fix me, and we'll deal with it later.
Yeah, absolutely. So our research shows that the single largest pain point for consumers is understanding cost. So the key is providing them simple, easy to understand information on options and costs, helping them feel more confident, helping them understand beforehand what they're going to pay. So the concept of helping you know before you go is a significant step in removing that uncertainty that leads to improved access to care. So your example is 100% true. What we know is that consumers frequently equate high cost to high quality when it comes to healthcare, but that really isn't the case. So the same MRI machine producing the same MRI scan at the local hospital can cost $4,000, when just down the street at a freestanding imaging center, that same MRI can cost only $400. So the cost variations are significant, and you want to make sure that you can provide people with access to the information up front so they're more informed. So we help consumers find high quality, lower cost options, which is critically important as cost pressures increase. So consumers may not be able to afford and shouldn't have to afford a $4,000 MRI bill, but they can avoid $3,600 in cost in this example and only pay $400 simply by shopping around. So providing ways in which consumers can become informed, know before you go, really does reduce that friction on cost and makes it, helps consumers feel more confident in making care decisions and ultimately getting the care that they need.
Is it a concerted effort to keep these costs shrouded in mystery from the people that need them the most, that need that information the most? Or is it just a quirk in the industry where, insurance companies, payers, they say, well, as long as the consumer is fixed and they're okay with it, we'll just business as usual. We don't really need to make any effort to inform them as to what's going on with the cost.
There has been a concerted effort over the last decade to make access to information more readily available. And some of the federal regulations, specifically under the heading of transparency and coverage, are continuing to make that information more readily available for consumers. We believe that trend will continue. We think of it as we're in the first inning of a 9-inning ball game. we think there's going to be continued bipartisan support for improving access to information. So you will continue to see that information becoming more available. What most consumers may not know is they probably have access to this information today. If they log on to their health insurance member portal, or they use programs like Zelis' SmartShopper program, you can quickly find access to the information that you need. So it's out there. We just, as consumers, as you mentioned before, we tend to follow the doctor's orders. We've got to shift our mindset and really become empowered consumers to find out information beforehand, because we can save ourselves collectively, thousands of dollars simply by shopping around.
You mentioned transparency and coverage. It's a rule. Is that a rule of thumb? Is that a guideline implemented in the industry? You mentioned legislation too, bipartisan legislation possibilities.
It really is kind of federal regulation that is going to require that payers provide access to this information. So even though it may sound like a rule, it really is the law of the land. So compliance is coming. And as the deadline for compliance approaches, you will continue to see more access to information. So the positive direction is it's providing more access to consumers over time. Really, the challenge is, how do we make it as an industry easy to access and, more importantly, easy to understand? Because what we know is consumers are looking for essentially three things now. They're looking for clarity, they're looking for confidence, and they're looking for guidance. So we've got to take the spirit of the transparency and coverage and turn it into information, tools, and programs that are simple and easy to use.
Tell us how Zelis is involved in giving consumers the options, that transparency that we need to make those decisions.
Sure. So as I mentioned, consumers are looking for clarity, confidence, and guidance. That's what we know. That's what they continue to tell us. So tools provided by Zelis, such as our SmartShopper program, bring these criteria together, make it simple for consumers to find and get the care they need. So we show options in a consumer's area, along with cost and quality, enabling consumers to make an informed, confident choice that works for them and their family. But also important is we provide live concierge support to answer questions. We may help make or reschedule appointments, make sure that a consumer has transportation to be able to get access to the care that they need. And then we're going to follow up after the appointment, see if there's any further care needs, see how the procedure went. So the key is making it super simple and helping consumers know we're there for them in terms of the support they need. So healthcare is complex. We want to make sure that we're providing tools and services at Zelis to make that experience much more simple. Again, providing clarity, giving people the confidence to make choices, and then the guidance to know that we're there to support them through the process. So back to the MRI example that we were talking about earlier, a phone call or a few minutes online could help consumers avoid $3,600 in cost and receive a high-quality MRI at a fraction of the price. Those types of cost variations exist across hundreds of medical services and tests. So the information on cost is available, as we talked about, through your insurance member portal or through programs like Zelis, SmartShopper. I would strongly encourage all consumers to spend a couple of minutes to get informed, because it can literally save you thousands in unanticipated cost.
Is there anything that you'd like to add for us? And then give us a website where we can learn much more about Zelis.
Sure. I'm highly optimistic for the future. The key is really making healthcare accessible, easier to understand, giving people tools and programs. And when you think about the pandemic, it has accelerated the use of digital tools across all industries. And those same level of expectations are coming to healthcare, which is what we're focused on, is making sure we provide information for consumers to make it simpler, help them not only manage their care, but also their healthcare finances, which is something that we do at Zelis. So I'm excited for the direction that the industry is headed for as a whole. So to check out more, please visit www.zelis.com, and you'll appreciate the time today.
Rob, thank you so much for joining us here on Health Professional Radio.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Rob Graybill. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.